Welcome to video podcast 4. This is Pulmonary Imaging Differential Diagnoses Part 1. I'm William Herring from Albert Einstein Medical Center in Philadelphia for Learning Radiology. The differentials we're going to talk about are not intended to be all-inclusive. They're designed to be an aid to remembering a few of the most important causes of each of the findings shown, and consult a textbook for all-inclusive differentials. The way that this videocast is going to work is first a case is going to be shown as an unknown. You identify the differential that the case exemplifies. Use the pause control on your MP3 player or computer. Then the next image will be the title of the differential. In this case, anterior mediastinal masses. Again, use the pause control. The next image will reveal the differential diagnosis itself, and the last image for each set of differential diagnoses reveals the diagnosis of the original case. This podcast is designed to be used as either an audio-only or a video-only podcast, or both. So let's start with the next case. This is the differential. Pause the player. The differential is anterior mediastinal masses. There are 4 answers. Pause the player. The differential for anterior mediastinal masses is thymoma, teratoma, substernal thyroid, and lymphoma. This is the next differential. Pause the player. The differential is acute airspace disease. There are 4 causes. Pause the player. The 4 causes of acute airspace disease are pulmonary edema, pneumonia, aspiration, and hemorrhage. This is the next differential. Pause the player. The differential is pneumomediastinum. There are 5 causes. Pause the player. The 5 causes of pneumomediastinum are ruptured esophagus, ruptured trachea or bronchus, iatrogenic or traumatic, asthma, and rarely pneumoperitoneum. This is the next differential. Pause the player. The differential is chronic airspace disease. There are 4 causes. Pause the player. The 4 causes of chronic airspace disease are alveolar cell carcinoma, alveolar sarcoid, lymphoma, and alveolar proteinosis. This is the next differential. Pause the player. The differential is an opacified hemithorax. There are 4 causes. Pause the player. The 4 causes of an opacified hemithorax are atelectasis, pleural effusion, pneumonia, and postpneumonectomy. This is the next differential. Pause the player. The differential is for large cavitary lung lesions. There are 3 main causes. Pause the player. The 3 main causes of large cavitary lung lesions are abscess, carcinoma, and tuberculosis. This is the next differential. Pause the player. The differential is upper lobe predominant disease. There are 4 main causes. Pause the player. The differential for upper lobe predominant disease is tuberculosis, reactivation tuberculosis, silicosis, eosinophilic granuloma, and ankylosing spondylitis. This is the next differential. Pause the player. The differential is for bibasilar interstitial disease. There are 6 causes. Pause the player. The 6 major causes of bibasilar interstitial disease are bronchiectasis, aspiration, especially of chronic, desquamate of interstitial pneumonia, asbestosis, sickle cell disease, and scleroderma. This is the next differential. Pause the player. The differential is for micronodular lung disease. There are 4 main causes. Pause the player. The 4 main causes of micronodular lung disease are metastases, sarcoidosis, pneumoconiosis, especially silicosis and asbestosis, and miliary tuberculosis. This is the next differential. Pause the player. The differential is small cavitary lung lesions. There are 4 main causes. Pause the player. The 4 main causes of small cavitary lung lesions are septic emboli, rheumatoid nodules, squamous or transitional cell metastases, and Wegener's granulomatosis. This is the next differential. Pause the player. The differential is lymphangitic spread to the lungs. There are 6 main primaries to consider for lymphangitic spread to the lungs. Pause the player. The primary carcinomas to consider with lymphangitic or lymphatic spread to the lungs include lung cancer, breast cancer, stomach carcinoma, pancreatic carcinoma, laryngeal carcinoma, and cervical carcinoma. This is the next differential. Pause the player. The differential is for multiple lung nodules. There are 5 main causes. Pause the player. The causes for multiple lung nodules include metastases, Wegener's granulomatosis, rheumatoid nodules, multiple AVMs, and septic emboli. This is the next differential. Pause the player. The differential is for pulmonary interstitial edema. There are 3 main causes of pulmonary interstitial edema. Pause the player. The 3 main causes of pulmonary interstitial edema are congestive heart failure, lymphangitic or lymphatic spread to the lungs, and an allergic reaction. This is the next differential. Pause the player. The differential is for shifting infiltrates. There are 6 main causes. Pause the player. The causes of shifting infiltrates in the lung include Leffler syndrome, allergic bronchopulmonary aspergillosis, asthma, aspiration, polyarteritis nodosa, or viral pneumonia. This is the next differential. Pause the player. The differential is for chronic interstitial disease, pulmonary fibrosis. There are 6 main causes. Pause the player. The 6 main causes of chronic interstitial disease are pneumoconiosis and interstitial pneumonia, granulomatous disease, neoplastic disease, idiopathic fibrosis, and collagen vascular disease. This is the next differential. Pause the player. The differential is for unilateral hyperlucent lung. There are 4 main causes. Pause the player. The four main causes of unilateral hyperlucent lung include Swyer-James syndrome, pulmonary embolism, pneumothorax, and obstructive emphysema. This is the next differential. Pause the player. The differential is rapidly clearing airspace disease. There are four main causes. Pause the player. The four main causes of rapidly clearing airspace disease include hemorrhage, pulmonary edema, aspiration, and pneumococcal pneumonia. This is the next differential. Pause the player. The differential is for masses with air bronchograms. There are three main causes. Pause the player. The three main causes of masses with air bronchograms are lymphoma, alveolar cell carcinoma, and pseudolymphoma or maltoma. This is the next differential. Pause the player. The differential is for a cavitating pneumonia. There are four main causes. Pause the player. The four main causes of cavitating pneumonia are staphylococcal pneumonia, streptococcal pneumonia, tuberculosis, and a gram-negative pneumonia like Klebsiella.